Maharashtra is likely to extend the existing restrictions for 15 more days. This is what the Health Minister Rajesh Tope has said. The lockdown-like restrictions which were in place till the 1st of May, now likely to be extended by another 15 days. Cabinet ministers made this recommendation to the Chief Minister and seems like it's now been accepted at the moment. It is in fact to be looked into at the moment by the Chief Minister. Saurabh Gupta joining us with the very latest. So Saurabh, it's not the final decision yet, but the fact that the cabinet ministers have written in, it's more likely to be accepted by the CM?
Yes, that's usually the case because, of course, it's a cabinet, it's a recommendation, and the chief minister usually goes by the recommendations of the cabinet. That's how it works in a, parliamentary system. But obviously, at this point, the recommendation of the cabinet ministers is to extend it by 15 days because by then one presumes that the state will also be able to start vaccinating the 18 to 44 age group category of people who have still now not received any vaccines and who are the ones who are out on the streets usually when things resume. So obviously in this situation, the cabinet felt that it would be wise to continue the restrictions for another 15 days and then sort of, once the vaccinations for the 18 to 44 category starts, scale it up and also slowly open up after in due course so that the majority of the population that's actually out on the streets, the workforce, is vaccinated to some extent.
Sort of very quickly, also want to understand from you, is there any internal statistic happening within the government which tells them whether or not the lockdown is working? We've seen the positivity rate effectively come down in Maharashtra, specifically in Mumbai as well. Any internal statistic telling them that it's working?
Well, I couldn't hear your full question, but if you were asking me about the number of cases in Maharashtra, there is a little bit of debate on that. Testing figures also seem to have come down a bit. But the explanation is that, testing is strategic. Testing is not now random testing. So once somebody tests positive, then they sort of test people who may have come into contact with them, or people who are traveling, or other such categories of people. Now, in this case, what seems to have driven the lesser number of tests is the fact that lesser number of people have tested positive, perhaps the last 2 or 3 days. And that's something that's also, being discussed. But Maharashtra's statistics seem to be leveling off at this point. But clearly, nobody is letting their guard down, at least as far as the administration is concerned. In fact, they are still going ahead and building more COVID jumbo centers to create capacity because there's still a shortage of ICU oxygen ventilator beds in the state.